Hello and welcome to a very special spirituality group with Dr. Anoop Kumar. Dr. Kumar is who likes to be called Anoop because he's just a regular guy like us. Um, he, he was a ER doctor, and then he had a spiritually transformative experience. And without further ado, I present Anoop Kumar, who also has very special feelings about this whole concept of mental health and mental illness. Let's hear from Dr. Anoop. Go ahead, Anoop.
Thanks, Dan. Thanks, everybody. It's an honor to be here with you. Can you hear me okay? Everything's coming out okay? Okay, great. Um, I really see this as a conversation, so feel free to jump in, anybody, anytime, so we can have the conversation. I'm coming at this from many different perspectives. One is as an emergency doctor, one is as somebody who was raised in a very philosophical and spiritual family since I was very early in my life. So I have different ideas about consciousness and mind and the world than probably most people do. Definitely as a kid, I did. I'm also coming at it with people in the family that would have been diagnosed or that have been diagnosed with what we call mental illness. And as Dan said, a I have different takes on what that means. Um, and what else? And somebody who's been through experiences myself that easily could have been called mental illness, but because of my training in both medicine and some of the experiences I've had, um, I know how to navigate that, I guess, in a way that doesn't get certain labels and things like that. So that's my background. Let me tell you, I guess, about that experience that Dan was talking about. This was when I was in medical school. And again, feel free to stop and ask questions at any time. I think, at the end of my third year or so, and I was home for a break at my parents' house for a couple days. And I was sitting in my room and reading a philosophy book, like I've done hundreds, thousands of times in my life, and reflecting on it. And it, it let me tell it in real time first, and I'll give you my retrospective take on it. All of a sudden, I was reading this book, and it was like a bomb went off. Okay, out of the blue, nothing strange, nothing that was expected about it. It was like boom, and I was sitting in a bright orange blaze. Okay, the room had gone away, my body had gone away, and it was just a blaze of orange. And it was an amazing, scintillating, blissful, peaceful blaze, right? And the way I describe it is like I was sitting in the sun, which is so strange. Who would ever say I was sitting in the sun? But that's the only way I can say it. To the extent that I really feel it is the sun, and I have different takes on what the sun is, that's a different story. But here I was in the sun, in this absolute blissful, peaceful blaze for some timeless period. Okay, I don't know how long it was, or and as if I was just drinking it in and drinking it in, like all the thirst that had ever been, all the restlessness that had ever been in my life was quenched. And at some point, I I was going through it, so it was like that was a portal where I had kind of repleted myself. I had fulfilled myself and I was done. And it was like there was nothing left. And so I was going to go through this portal, and I knew that my lifetime would be over. I knew that that body would be over. I knew that I felt that, I should say. Um, and I knew that if I took one more step, I felt that if I took one more, that was it. There was no going back to this lifetime. And part of me, I guess, part of me was hesitant, but there was a much, 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 much bigger part of me that could not resist. That was like, I'm done. I'm good. I'm good. And that was pushing me through this portal, like this part of my personality, I guess, whatever it was. And just when it was going to be done, the point of no return, this being of light emerged from the sun. Uh, and it didn't have any like head, arms, or anything. It was just like a part of this blaze just kind of came forward, almost like silhouetted in a way, and put this knowledge into my mind that this wouldn't be fair. And and the feeling that there was much more to do. And it just gave me pause. I think I didn't really want that pause because I wanted to just be done with it, but it it gave me pause because I knew this was true. Somewhere deep down, it felt real and true, and that gave me pause, and everything shot back, and there I was sitting in the room again. So it was like going through it. It was like whoa, like re-imploded, and there I was sitting in the body or with the body in the room again, and everything had changed. This was in my late 20s. Everything had changed, meaning that I was no longer inside the body. The body was kind of like this clothing, right? It's like, okay, yeah, you can put it on, you can wear it, you can use it. Um, the whole, it looked like everything was made out of light. So it looked like space was structured out of light. It's not that space is empty, but space is made out of light. Objects are made out of light. Our thoughts, our emotions, our feelings, what we call space and time and dimensions are made out of light. Um, it's as if when you perceive, like when you look, how kind of you look with your eyes, and then we all know that your eyes are connected to a nerve, and the nerve is connected to your brain. So that's like your whole looking apparatus, right? Your looking mechanism is like um, eyes, optic nerve, occipital cortex of the brain. That's your looking apparatus. But there's actually something behind that that's actually looking, and it just looks through the brain and through the optic nerve and through the eye. And it's like now I was looking from that. So I didn't need the eye or the nerve or the brain. And in fact, when you look through the brain and the nerve and the eye, the world looks different than when you look and you see that the brain itself is something that you can look at. It's not something that you look from. And it's as if that happened to all my senses, like sight, smell, taste, touch, like eh, and that was pretty transformative to say the least. I got up from the seat that I was in, and I felt like a newborn baby. Like I was kind of like, almost like how they cruise and hold on to things. It was kind of like that. And I remember going into the bathroom and I looked in the mirror and I didn't recognize the guy. I was like, who is this guy? Because this guy looked really peaceful, and I was not a peaceful guy. I was a quiet guy, introspective guy, but I had a great deal of internal restlessness, and that wasn't there on that face. So I didn't recognize this guy. And it took a while to kind of, I guess, like forget about it in a sense, even though things had changed. And that was towards like the most difficult part of medical school had already been over. Like the first 2.5 3 years, like that was over. So I was kind of cruising in my last year, and so it didn't require cognitively that much of me, medical school, as the beginning part of it. But then after that, after a year and a half or something like that, I got married and I started my training in emergency medicine. And I did my residency in Philadelphia. And that's when all of a sudden, like I had to use my mind like crazy because it was like a huge learning curve to get to that clinical learning. And that's when I realized, whoa, I am way out of my league. Like I do not have a grasp of what this has done to me and how to use this. And I just want to put a little note in. I think, I can't speak for anybody. I'm learning from you, here, but I think this happens to a lot of people in different ways. Maybe not the same story, but I think a lot of people get to a place where they're like, wait, I don't know how to use this apparatus. Like, I don't really understand what my mind is doing, what my body is, what is a relationship, what is the world, who is other, who is me, what is God, what is life, what is awareness, what is nature, what is alive, what is dead. Like all of this was up for grabs. All of it was up, and it was live. I couldn't ignore it. I was lucky for three reasons. One, I had been told since I was a child that the world and the way we understand the world is basically BS. Like the standard knowledge, including in science and experts, don't really know what they're talking about, or they know a lot about very little. Let's put it that way. And so I had always been taught that mind, consciousness, awareness is primary. I never totally bought it, but I was actually intellectually, I wasn't challenged by it. I was like, yeah, that could be true. Whereas most people will be like, that's crazy. It's the brain. Everything comes from the brain. It's neurotransmitters, right? So I had that big advantage. I wasn't cognitively biased like that, and it didn't threaten me to think in that way. Even if all the experts would say otherwise, I didn't feel like, oh, maybe they're right and I'm wrong. I never felt that way. I was like, well, I don't really think they know what they're talking about. And I think that gave me an advantage. Number two, I had been trained as a doctor, so I know how doctors are trained to think. So I know the pitfalls of saying certain things or putting things in certain ways because doctors get scared because their training is on one way. They don't know how to understand it a different way. Because then who are we? If that's not true, if this mechanism of action isn't true, then who am I? Okay, let me pause. Harvey, go ahead.
Yeah, I'm only interrupting you now because we're going to be called for lunch in a few minutes. But thank you for what you said, because when I was 30, I had an experience in a yoga class. I had two wonderful women on either side of me. I was on a blanket on the floor. And when he said to go into the um, full lotus or any form of lotus that you can get into,
Yeah,
for the first time in my life, never before and never since, I was able to get into a full lotus because my body was like a piece of rubber and I left my body. But it was the most frightening thing because I was not prepared for it like you
yeah,
were. And
yeah,
so I was frightened like crazy and didn't know if I'd be able to return.
yeah,
When I finally did return, the first thing I did was I walked up to my teacher and I hugged him for reality
yeah,
and told him what
yeah,
had happened to me.
yeah,
And he never really explained it for me like you're explaining it now.
yeah,
But I really appreciate what you just said.
yeah. Sure. Thank you for sharing that. Yeah, and that speaks to one thing is that like this is just like human nature what we're talking about. This is not for certain people. This is not something that happens to, I mean, yeah, it happens to different people in different ways. Sometimes the things happen in dreams and we don't remember it. And sometimes things like this happen. And you may be surprised to hear this. I don't know, maybe you're not, but sometimes things happen and we can't figure out what it is, and the mind blocks it out, and you actually don't even remember that it happened because the mind sometimes will get terrified. It's like, whoa, this is not supposed to happen, or this is the devil, or this is like, there are all these stories around some of this stuff. I'm not supposed to this. That's not for me, or all this kind of stuff. And if you can't put a cognitive framework around it, the mind rejects it and doesn't even know that it happened. So I think the commonness of this, or the common potential of this, that this is something that is about all of us, I think is really important. Um, so where was I? So, and then the third thing, so I was talking about the advantages I was fortunate to have. One was that different understanding, that possibility, not being threatened by another possibility. The second was being a doctor and having the training. The third was I actually had a teacher or a guide who was near me in Philadelphia, who was a monk who had been in this line. I mean, he had dedicated his whole life to this. He was probably in his 50s or 60s or something at the time, and who was I actually didn't talk about this experience, but people like that, they know when they see you, they know what you've been through, they can see where you are. And so I didn't talk about this, but I had all kinds of questions, and he was just like, he was so like blasé about everything. He was like, yeah, yeah, just kind of be like this, or he would just say something so minimal that made it so normal. See what I'm saying? It's the idea of normalcy. That word is tricky, but it's so critical to be like, this is just everyday stuff. This isn't special stuff. I don't consider this spiritual stuff personally. That's my take. This is human. It doesn't matter if you're spiritual or religious or atheist, or this is human nature. This happens to all kinds of people. And I think it happens to most people in different ways, not necessarily as flashy, but in different ways, a little different aha moments that we can't necessarily integrate or make sense of. So it doesn't kind of stay in our memory. So my first 6 months or something of training was super hard because of this, because I had to use my mind in old ways, like the old system thinking, classic medicine, physicalist medicine, and my mind was not there anymore. It left that, like, it felt like lifetimes behind. and my mind was operating in a totally different way. So I had to fake it. And my supervising doctors would be like, "Yeah, he's here, but he's not here." I would get comments like this in my reviews. Yeah, he's very capable, but he's always talking about the state of healthcare and something else or something like that. And and I could see all the perspectives, and I was just like, all right, bide my time. I was like, I need this to integrate. I need this to integrate. I need this to integrate. And like I said, I had those three advantages. I was very lucky. Um, and after 6 months to 8 months or so, it did get actually, my teacher at that time said that. He goes, wait till spring. This was around fall, when my training started. He goes, wait till about March. And sure enough, it was actually end of January. It was a little bit earlier. It got a lot easier, 20, 30% easier. Um, but then it took probably about 12 years for me to really integrate that. It took until I was about 40 years old, something like that. I'm 46 now, to really integrate that, to get it, to know how to use it, to stabilize in it, to learn the dials. So that's another thing I found is there are dials. There are certain dials in the mind. Obviously, I don't mean it literally. I'm just saying like how it feels. There are certain things we can do with our attention. And I'm sure everybody who's sensitive knows this. You put your attention on certain things and you can make certain things come out. So you can make emotion stronger, or thoughts stronger, or intellect stronger, or perception stronger. If you believe in other dimensions, etc., you can increase your perception of other dimensions by doing certain things. Um, and so it was just a whole reorientation, that I feel very grateful and blessed to have been through a very difficult time, and to be in a place where hopefully I can share this, um, and give new meaning to experiences people are having. So I'll pause here for now, and then just see if there are any comments, conversations.
All right, folks, if you have the ability to raise your hand, please do. If not, just unmute yourself and speak if the spirit moves you.
I know I'm brand new. If I would like to say just a really quick thing, um, if people can hear me.
Yep.
Thank you very much for what you've said. Um, I had a similar experience myself, um, about 4.5 years ago, and just the commonality of this, the resonance that I feel just here and among many people I talk to is very gratifying. I can definitely share more of that story. It was quite dramatic, and it has continued to be quite dramatic for me. But just the universality of this, I think, is very gratifying. I don't know if you saw me nodding to basically everything you said, because I had a similar experience. The integration is kind of a key word. And so that's basically what's been coming up for me. I had just kind of a recurrence of things just somewhat recently. And so it's that integrative process of the wholeness of the human all coming together, where there tends to be kind of a partitioning of things into, like, the body, the spirit, the mind, the whatever. But it is really a dynamic place that is happening. And so that kind of integration process happened for me as well over the last 4 years, rather dramatically. And so I just wanted to say that I'm happy to share if anybody would like to hear more of that. There's a lot to it. I've lived several lifetimes just in the last 4.5 years. But again, the other word you said that really struck was portal, because I think that everybody is a portal of some sort into some whatever it is. And yeah, so please continue to share your story. I'm definitely happy to share more as well if people are interested. But just that the resonance that I feel just listening to you has been beautiful, and I'm very pleased to be here. Thank you.
Thank you, Chris. And if you would like to be a guest speaker at this group to share your complete story, we can work that out. Tiffany can help, and we'll do that. Kira Lavenger, you're next.
Hi, thank you, Dan, and thank you, Anoop. I am talking kind of low. Somebody's sleeping like usual, and also like usual, this has been my sort of I don't know. A lot of my focus lately is trying to understand sort of the the balance combination of light and dark. I mean, Anoop, you talked about lightness, and I'm, wondering where darkness is in the equation. I just, it's, I don't know. I feel like you know that yeah, like me and a lot of people came from overly dark childhoods, and then it seems like in I think this country especially, I'm not sure, there's such a focus on like lightness and positivity, um, and I'm trying to like figure out for myself um, what you know kind of the most you know resonating balance um, that makes sense for me, and I'm wondering what your take on that is. And also another thing is I'm also trying to uh, see my existence more in terms of like being an animal, and like trying to look to how other animals seem to exist. I mean, I think that one of the spiritual things that I experience a lot is just never knowing um, what their existence is really like. There's something spiritual about that. So I'm also wondering, so about asking you about the lightness and darkness, and also about how you yeah, just how you relate your experience to um, how our fellow creatures experience things, if that made sense.
Yeah, sure. So I'll start with the animal thing. There was a time in around medical school again, towards the beginning of it, where I was meditating a lot. I had meditated on and off since I was a kid because my family was into that stuff. But uh, I got to a time in my life where I felt like there was just a lot of stuff in me. That's just what it felt like. It's like all the stuff that needed to come out and be released. Um, and for whatever reason, I started getting into meditation, and then would start doing some really intense meditations, like for a couple hours at a time, before I would go into the hospital. So I'm talking like 4 a.m. for a couple hours, and then before I slept at like 10 a.m. for a couple hours. There was a period where stuff felt like a lot of stuff was coming out, and during that period, I would sometimes this like urge to behave like an animal would take over me. So I would start like crawling around in my room. I wouldn't have done it if there were other people there. And I wouldn't have told anybody this like many years ago, but at this point I don't really care. But I would like I felt like I was a tiger, and I would start crawling around and snarling like in the dark. Nobody's there. I'd be like, it just felt like I was a freaking tiger, and I had to get that out. I felt like that was in my personality now from some time in the past, and I didn't need that now. I didn't need to be a tiger. And I had to express that to release it. And had somebody seen me, they would have said I was psychotic or anything else. But like I said, these were the advantages that I had. I could allow myself to do things that maybe other people won't allow themselves to do because they're scared that it's weird or it's ill or something like that. I mean, to this day, many of the things I say or do, I think many other people experience, but they would be scared to say it publicly because of what people might think. Um, so that's speaking to what you said about animals. I think about animals is they just do what they do. They have no thought to filter it for the most part, right? What they feel, they do. And there's an advantage in that. If you can do that in a safe environment, there's an advantage into getting that out of you so you can move on. So I think it's like the same thing when we see a newborn baby. Why are we all like magnetized by babies? Because they do whatever the hell they want. and they have no self-judgment about it. They'll pee and poop in your face, and they'll smile at you while they do it. And I think there's something freeing about that, um in for us, because I think it's such a highly restrictive and judgmental society that teaches us to self-judge so much. It judges us, we self-judge out of our genius, I feel like. And then about light and dark, I think, there is, to me, there's a lot of light and there's a lot of dark. The way I see it, it's not right or wrong. The way I see it is that darkness is less light. I don't see light and dark as two different things. I think they're the same thing, but because of our human tendency to polarize, we say, "Oh, this is light and this is dark." But it's the same thing. There is a, let's just say, a potential, and this potential expresses, and its expression we humans take as either light or dark, good or bad, etc. And I think when the universe expands out and creates, and then when it contracts back unto itself, it comes back to the single point of potential that I don't think is necessarily light or dark in my view, although we can call it light. Um, I think there's a tremendous amount of darkness in this and many worlds, and there's a tremendous amount of light in this and many worlds. And I think different worlds and different dimensions are different degrees. Some are intense light and some are intense darkness, and Earth is somewhere in between. And I think, to me personally, it's important to not judge darkness. Otherwise, we fall into the polarity of it, right? As we see that light and darkness isn't the same thing, I think they come into a natural balance. Like, I don't have a goal to be all light or to be blissful or to be enlightened, or like, I don't have any goals like that. I used to, but I don't really. Because you have to express a certain way. Otherwise, you don't stay here in this plane. The only way you can stay in this plane is with a certain mixture of polarity. Polarity defines this plane, right? So it's how we all have our strengths, and somebody else's light counterbalances my darkness, and vice versa. And that's the beauty of it. You know, the the problem is when that's all weighed down on top by self-judgment and restriction. That's where I see the problem is. It's not so much light and dark. I think light and dark would resolve itself if we all could just be our free selves.
Anoop, do you still have to leave in about 5 minutes?
I got 10 minutes.
You got 10 minutes. Okay, so Mary and Tiffany, hopefully we'll have time for you both. Mary, go ahead. Unmute, Mary. Let me give you the unmute option, Mary. Go ahead, unmute. There you go.
Hi, Anoop.
Hi.
We are connected on LinkedIn, and I feel like we are twins from different mothers because I so resonate with your message, and it's so nice to see you live here. And right now, I'm in the process of how you phrased it was learning the dials. So I'm applying for a PhD program now in wisdom studies. So, and my story was I had a psychotic episode in 1998. And in 2016, I was fine all those years in between in the mental health system. And then in 2016, I had another psychotic episode. And I came out of the hospital and went, I don't think that's mental illness. I think it was my body, mind, and spirit trying to realign. So that's when I totally went into researching the mental health system, spiritual awakenings. And so now I'm in a place now where I believe it was my spirit crying out and saying, what is it about your spirit that you're not letting out that needs to be expressed? So that's where I am now. And I just wanted to mention that I really, really loved your audio of, I think it was called What If Mental Illness is Really Mental Wellness? And I shared that with a lot of my network. And I think that's a really important message. And I'm still referring people to that. And so I just wanted to thank you for being here today and for the work that you're doing. I do, like I said, follow you on LinkedIn, share your posts, and I'm just super excited for the work you're doing right now in the medical field. Thank you.
Thank you. We need to share this message. I think I think the audio was something like, what if the people who are quote unquote mentally ill are the sane ones?
Exactly.
And that's personally the way I feel, and I'm not trying to minimize anybody's suffering. I think we really we have this huge conglomerated concept of mental illness. Yeah, I see you, Tiffany. I promise we will get to your comment also. This is huge. And please, if this resonates with you, please spread this word. This is, I think, one of the biggest things that has to happen in our society around this topic. We need to separate the concept of mental illness and suffering. They need to be separated. Right now, if we challenge the concept of mental illness, what happens is there's this big rush to like, what do you mean? People are suffering. How dare you say what you're saying about mental illness? And part of that is coming from people who are, of course, suffering. And part of that is coming from an establishment that benefits from the concept of mental illness. My goal is in helping people suffer less and heal and feel better. That should be the goal, right? And if mental illness helps that kind of way of thinking about it, absolutely, let's use it. And if it doesn't, then let's not use it. But right now, the concept of suffering and of mental illness are so closely woven that I think it hurts a lot of people while making it seem like we're helping. So I think it's super important to separate those things. And I personally think I'll give you a quick example just to show this that if you come to the ER and you say, oh, it burns when I pee and I have pain down here and then I kind of have a fever, this, that, and I do some tests and I say, well, it looks like you have a kidney infection, right? That's what's going on. And if it burns when you pee, it doesn't mean you have a kidney infection. I'm not trying to scare anybody, but I'm just trying to give an example here. And let's say that the patient then says, oh, okay, Dr. Kumar, I get it. Can you explain to me what the kidney is? I'm sure the kidney is it's like a kidney bean shaped organ. It's here in the flank and it filters blood and it takes out the stuff you don't need and it puts that into the urine and the other stuff it sends back into your bloodstream. Okay, cool. Can you tell me where it is? Sure, yeah, I can point to the flank. It's here and it's on this side. Okay, good. Let's say somebody comes in with pneumonia, fever, cough, chest pain, getting worse, trouble breathing, et cetera, et cetera. Again, most of those symptoms are not pneumonia, but sometimes it is, not to scare anybody. And I say, well, it looks like you have pneumonia. Oh, okay, doctor, what is that exactly? Well, pneumonia is when you get inflammatory fluid from an infection that's in your lung so that your lung can't exchange oxygen as well as it should normally. Oh, okay. Can you tell me where the lungs are? Sure. One over here, and there's one over here. It's over here. Okay, great. Another person comes to me and I say, well, it looks like you have a mental illness. This is psychosis and mental illness. Okay, doctor, can you tell me what the mind is? I don't know. Right? Mind is not the domain of medical science. Okay, doctor, that's kind of sketchy. You're saying I have a mental illness, but you don't know what the mind is. That's a little bit scary, frankly. Okay, at least tell me where the mind is. At least let me reassure myself. Where is the mind? Yeah, I don't know. Your brain is here, but I don't really know where your mind is. I mean, do you see the insanity of it? Like, this is what I mean by we need to just stop and step back a little. I'm not saying these ways of thinking are not useful, they don't have a place, etc. They do, but I think all of this really benefits a way of thinking and a system whose main interest is not in helping people heal. That's what I believe. And we should use it as people find it helpful, but we should also educate people to see how little we know about the mind, about the world, about the capacity we have to heal, and about the actual meaning. The key word is meaning of these experiences that we're. Yes, Tiffany.
Thank you so much. I want to talk about some things here. When you were talking about the animal piece and things, I want to resonate on that level right there. I'll start with an acting coach, Stella Adler. She wrote this book called The Art of Acting. And part of what she prescribes is 15 minutes a day of animal noises in order to loosen yourself up, you know? And then I wanted to say that I believe you are telling the truth, especially with the tiger. I'm currently in a yoga teacher training class program. And the head instructor definitely lives on the cloud somewhere, right? Like she's just great, right? But just going through the Vyagri Namaskar, the Tiger Namaskar, and going through that, the power of embodying the concept of the tiger, um, really helped me. I paired it with something my father would always tell me about everything. Everything he would tell me, make it your friend. Whatever it is, make it your friend, And then with that, with the tiger, being able to look at it, just when you're in whatever the tiger pose is for you, because some people's bodies can't get into that pose, but you can understand the concept of a tiger looking at something with curiosity, and making it your friend, being able to look at it. I had to first make the tiger my friend. Then I had to use the tiger to make this issue my friend, you know?
Yeah.
So I want to thank you for that because you're telling the truth. Getting up, acting like a tiger, buddy, that's some powerful medicine right there.
Yeah.
And even right now, we're going through our Ganesh sadhana. Acting
Mm-hmm.
like an elephant is some powerful medicine,
Yeah.
Yeah. So I think that when we're talking about the light and the dark piece, it's about bringing maybe that part of us back into the light.
Yeah.
That part of us that either used to act like animals or was restricted from ever being able to do anything playful, and bringing that part back into our life. Stella Adler, she's also on Audible, that book, and Dr. Kumar is at Numocore.com.
Yes.
For everybody.
Yes.
Okay. Thank you.
Numocore. So Numocore was something. Numocore is an acronym. Nu is nutrition, Mo movement, CO is connection, RE is rest. So it's nutrition, movement, connection, and rest. And how I came up with that is like, when I was in the ER, I felt like we weren't telling patients the truth. I don't feel like we tell patients the truth about how they can heal, because we're so trained to look at it in terms of drugs and devices. Like that's everything, right? But that's not how people actually heal. Like healing comes from your own natural potential and from nature and what we all have within us. And it is possible to activate these engines. And how these came about is this is what I did to regain a balance and a centering. Is I realized that, whoa, when I change my food, my mind changes dramatically. Like if I eat processed food versus whole foods, it's a huge difference in my mind. Movement is moving the body. It's just range of motion exercises. The way you breathe is movement. In yoga, there's a particular way to breathe. Connection to me is like outside. Being barefoot in the grass is huge if there are no pesticides. Being barefoot in the grass or barefoot in the ocean, sunlight on your skin, flowers, trees, connecting with others, asking yourself the big questions. Why am I here? What do I really want to do? What do I really care about? And then rest, sleep, but also knowing how to, even when you're speaking, when you're acting, how can your mind stay in a state of equilibrium? These are natural healers that we all have. Everybody has them, and they're almost all free. They don't cost anything more than you're spending now to do. And these are literally the most powerful. 50% of diseases, probably 80% would go away if we activated these 4 engines. I kid you not, 80%, 50 to 80% would disappear, including heart disease, including many forms of cancer, including tons of autoimmune disease, including what we call mental illness. These things would just start disappearing because we're doing what's actually in line with human nature and human potential.